And hello, everyone. For our next presentation, we will hear from Dr. Sharon Lewis, who is an associate professor of neurology at the Perelman School of Medicine and specializes in general neurology and neuromuscular medicine. Additionally, Dr. Lewis is the program director for the PEN Pipeline program, which is a mentorship and education initiative that teaches healthcare concepts to local West Philadelphia high school students and serves students who are underrepresented in medicine. She is also the assistant dean for diversity recruitment in the program for diversity and inclusion. I want to remind everyone to please ask any questions that you might have using the Q&A chat during the presentation. So please do so whenever you have questions. And now please welcome Dr. Lewis as she discusses the topic, Why Diversity Matters, and a toolkit for navigating your path into medical school. Thank you so much, Dr. Lewis, for joining us today. At this point, I'm going to stop sharing and I'll let you share your screen now.
All right. Hi, everyone. I am just going to share my screen. Give me 1 second.
Perfect.
Maybe. Give me a second.
Yes, no worries.
Okay, well, it wouldn't be virtual without some technical difficulties. I am not seeing the share your screen option.
It should be near the bottom of your screen. There's participants, chat, share screen. Can you see it?
Yes, thank you.
Yes, no worries at all. Perfect.
Okay, all right, thank you. Thank you for your patience. So good morning. Thank you, Alejandra, for that introduction. I'm excited to be here and to speak with you about why diversity matters and tips and tricks for navigating your pathway into medicine. So this is a brief overview of my talk. Why are the diversity of perspectives and your personal history so important to the field of medicine? Why are you important? And what are some challenges to pursuing a medical career and strategies to overcome them? And then most importantly, I want you to consider this simple phrase: who are you and who do you want to be? This is such a simple phrase, but if we spend some time in quiet reflection asking ourselves this very question and being present when you ask this question, meaning removing all distractions and regularly considering this question, then our next steps and path into medicine would be clear. It would make the no, but thank you for the opportunity, much easier when it does not align with the answers to these questions. It also speaks to remind yourself of the resilient, unique, amazing, and powerful individuals that you are. I hope that you ask yourself these questions often and give yourself some quiet moments, and also realize that the answer to this question may change over time based on your life experiences. So who am I? I was born in Pennsylvania and in Philadelphia, but moved when I was 4 years old to Fort Lauderdale. I went to school in Fort Lauderdale, meaning elementary school and high school, and eventually college and medical school at the University of Miami. When I was in college, I did a summer program. And when I was in high school, I did summer science and Saturday science. So I am a product of enrichment and pipeline programs as well. But in the summer of my sophomore year in college, I did a program which simulated the first year of medical school. And that program was really just formative in me really believing that I had what it took to get into medical school. So if you guys have those opportunities to do programs that simulate first years of medical school or just enhance you in any way, your training, all of these things sort of stack together to really help you really develop the skill set that it will take to be successful within medicine. This really did solidify, as I mentioned, my drive to go into medical school. And it's really important to sort of have those experiences. So when I was in undergrad, and this is this little plant here in the middle of the University of Miami sign, when I was in college, at that time I knew I was pre-med and I wanted to be a pediatrician. And as you can see in my introduction, I am a neurologist. So that, that pathway did change. But when I was in undergrad, I did a research project on spinal cord injury. And I wonder, as I think about my pathway, did that really impact, or was that the seed that was planted that sort of sparked my interest in the neurosciences? And then I eventually ended up full circle back to the University of Pennsylvania for my residency. And my thought at that time was that I'm gonna go, I'm gonna live in Florida. My whole family's in Florida. I'm gonna live in Florida for the rest of my life. And so I should go somewhere else to get great training and just have a different lived experience. So as you can see, again, I'm still in Philadelphia. And so you can see how those things change. So why neurology? Neurology was my last rotation in my third year of medical school. I did my pediatric rotation fairly early and realized that I really liked children, but being a physician to children was completely different than what I had in mind. So I don't know if you guys remember the story of Phineas Gage, if you guys have learned about him in your classes so far. So this was a gentleman who had an unfortunate accident with a tamping iron that went through his left frontal lobe, and it completely changed his personality. So these things and the way that the brain and body worked were one of the things that really attracted me to neurology. The stories of how something, could just, he lived despite this, devastating injury, but his personality was so changed. And so these experiences really made me really excited about neurology. The other thing is that, the rumor was that, for neurology, you just diagnose diseases, but you can't do anything about them. But actually, neurology is a rich area for a lot of research development. And I thought, this is an amazing career, and it's going to be a career that's going to evolve over my lifetime with more and more ability to, treat patients. So that was just really exciting. So what do I get to do every day? How do I, how did I know that I chose the right field? So I really love the longitudinal relationships that I get to develop with patients. I get to follow them. I only see adult neurology patients, but I get to follow them for years, to sort of help them navigate how their neurologic disease impacts their day-to-day life. The other thing that neurologists love to do is something called localize the lesion. So with our knowledge of neuroanatomy, we examine a patient and in real time through our exam, we're able to figure out for the most part where this problem is within the brain, spinal cord, muscles, or peripheral nervous system, or the nerves after the spinal cord. So every day, a patient's sort of exam really unfolds what's going on with them, and then I can determine a treatment strategy based on that. So I really, my best advice to you is that, discover your pathway, do what you love, and pursue it passionately. I ultimately really love being a neurologist. I like being an adult neurologist. And, these things sort of, as you can see, have evolved in my life over time. So I am at the University of Pennsylvania, which is, an academic institution. So why did I choose to stay in academic medicine? So one of the biggest reasons is that my other really important passion is really mentoring and teaching students. And so I wanted to stay in an environment in which I would have the ability to pay it forward. I can definitely identify within my life individuals who decided to take an interest and mentor me to help me get to my next step. And these people were instrumental in my life. And so I really wanted to be the person to give back. And so I stayed at Penn because I wanted to be able to give back. So these are just a list of some of the things that I do. I do wear many hats, and all of them are centered around mentorship and teaching. And this evolved from me asking the question of who I am, what drives me, and who do I want to be? And so those led to these, for my pursuit to these opportunities. So I ask again, that's my story. What is yours, and why are you important? The diversity that you bring to the table enriches the learning environment of everyone around you. For students that are underrepresented in medicine, Blacks and African Americans represent about 13% of the nation. Yet only 8.9% of physicians are identified as Black American, Black or African American, American Indian, or Alaska Native, or Hispanic or Latino. We know that race concordance and language concordance improve patient adherence, trust, and patient satisfaction. Having exposure to a diverse student body also may serve to improve healthcare disparities. And data has shown that your presence alone improves the academic environment, as well as improves cultural competency amongst your peers. And this is true for all STEM-based, science, technology, engineering, and mathematics-based fields in general. So your presence is extremely important. So I love this. This is a TED Talk by Chimamanda Ngozi Adichie, who's a writer and author from Nigeria. And so I am going to read this to you, which I tend to not read slides, but I think this is really important. So years later, and she's talking about she's talking about when she came to America from Nigeria to attend college. Years later, I thought about this when I left Nigeria to go to university in the United States. I was 19. My American roommate was shocked by me. She asked where I had learned to speak English so well and was confused. When I said that Nigeria happened to have English as its official language, she asked if she could listen to what she called my tribal music. I was consequently very disappointed when I produced my tape of Mariah Carey. She assumed that I did not know how to use a stove. She sort of concludes with, all of these stories make me who I am. But to insist on only these negative stories is to flatten my experience and to overlook the many other stories that formed me. The single story creates stereotypes. And the problem with stereotypes is not that they are untrue, but they are incomplete. They make one story become the only story. This is extremely important. The danger in a single story is that it can lead to healthcare disparities due to assumptions. And we know that explicit and implicit bias plays a role in healthcare disparities. There are studies that show that based on race, that there are discrepancies in how providers prescribe pain medications. For example, there was a study about long bone fractures, which are extremely painful. And Black and brown patients are less likely to receive pain meds than Caucasian patients, based on some ideas that Black and brown patients are more likely to become addicted, that their pain is not perceived, that is not experienced in the same way. Black women are also 3 to 4 times more likely to die from pregnancy-related causes than white women, according to the CDC. So the danger of just seeing a single type of physician or a single type of educational experience, or just having a single stereotype type of patient and person pursuing a field, going into medicine, is that when you just have one story, it can lead to healthcare disparities. And so we need the uniqueness that you bring to the table to really enrich the learning environment and to improve the physician workforce. So you should embrace your experiences because they make you who you are, but also realize that your presence allows patients, peers, and the academic environment to expound on their single story. So it is important to note that we often discuss racial disparities, but there are many ways to define marginalized communities. And for some people, there is an intersectionality within these identities, which creates additional barriers and obstacles. Our patients need us because they come from diverse backgrounds, and many come from disadvantaged backgrounds. And so we need to bring our unique experiences and seek diverse experiences to improve the healthcare outcomes of our patients. And these are just some other examples of marginalized communities and ones that we need to keep in mind. So what happens when we have these disparities? As mentioned, they basically lead to differences in healthcare outcomes. So this is a study in which these are patients who came in with strokes. And one of the treatments for a stroke is to give a medicine called TPA, which is a clot-busting medicine that improves outcomes. We've proven it to improve outcomes in stroke patients. And this study basically showed that Blacks, Hispanics, and also if you were underinsured or had Medicaid or uninsured, that you were less likely to receive TPA. So you can imagine the ramifications in healthcare outcomes when these decisions are being made based on your race or your ability to pay, or reimbursement patterns with your insurance. The other important thing to note is that we show that that poverty and mortality rate, as well as minority populations, that those things correlate. And so we need to examine not just what's wrong with this, not what's wrong with this race. That's not the question we should be asking. We should be asking, what are the structural barriers that are preventing ethnic minority populations to really achieve higher levels or be able to sustain an environment in which they're not living in poverty, which definitely affects their outcomes. So what does our physician workforce look like? So currently, the percentage of, as of 2018, this is from the AAMC data, our current workforce shows that African American Hispanic patients represent about 10.8% of the physician population, and graduates are about 11.5%. And so we do still need to work on diversifying this, the physician workforce, because there, as the years go on, we are going to have an increasingly heterogeneous U.S. population, and we need to have a physician workforce that really comes from a diverse background. And again, not just ethnically diverse, but also diverse on many other parameters. So one of the things that are near and dear to one of the programs that are near and dear to my heart is this educational pipeline program. And so this is really important to also, and I talked about mentorship, to really teach the younger generation that they also belong in these spaces and get this interest started early. So these are this is a program that I feel very strongly about. We teach health-based concepts to high school students that are from West Philadelphia. All of the students are actually underrepresented in medicine, and they get to come to the medical school and get to use some of the resources that the medical students use. But most importantly, the messaging is that they belong in this space, and I want them to understand that they can definitely tackle this material and they belong in this space. And even just that feeling that you belong in a space is really important. And I don't know, how many of your parents used to say, what are you teaching your younger brother and sister? So, I ask yourself, what are you teaching the younger generation? And again, I think the messaging needs to be that you belong in this space, your voice is important, and that you can achieve great things. And so, these are just, some of the things that I'm passionate about and why diversity really matters. So now that we talked about bringing diversity of your experience into medical school, how are you going to get there? So what are some of the challenges and some of the strategies that you need to keep in mind as you consider getting into medical school? So we're going to talk about financial challenges, how to be competitive, what does a good academic record look like? And academics obviously can be challenging. What is imposter syndrome? What are your supports? And then what are some competing priorities? So let's talk about finances. So getting into medical school is expensive. Every single step requires some type of cost. And you have to be savvy as to navigating how to get here without incurring so much cost, and are there sort of tricks around getting to medical school, and so it's really important to really examine each of these, and going into each step is beyond the scope of this talk, but these are things that you should talk to your pre-health advisor about. You should ask, can you waive certain fees? So these are just steps along the way in which you can ask, is there any way in which you can get scholarships, grants, whatever, to kind of help mitigate some of the costs that it takes, because this alone can be a huge barrier into getting into medical school, just the incurring financial costs that it takes to get along this way, along the way. So make sure you're asking questions, that you are not afraid to sort of push the boundaries of the things that you can ask for, and really importantly, negotiate. So there is which is wonderful, but there is this emerging and always been there. But I think recognition that this is also a marginalized group, and there are a lot of difficulties faced by FGLI. So first generation low income, and how do you define that? So right now people define it in different ways, but the general definition is that it's first generation is defined as neither of your parents receiving a bachelor's 4-year degree, and low income in general is if you qualify for a Pell Grant. Now, there can be variations to this definition, and these are not hard and fast definitions of how you define yourself as FGLI. Other indicators can be food insecurity, eligibility for government assistance programs, inability to afford basic needs such as housing or medication. And so this is just really important. A recognized group that needs, financial support amongst other things, mentorship and things like that, just to kind of, be able to help them along in their path. Penn does have, and this is, I'm at Penn, so I know some of the resources there, and there are other medical schools that are very much recognizing this, and undergraduate colleges that are recognizing FGLI students. And at Penn, there's a medical school group called Lift Us Up that really is there to support FGLI students. And they are also working on just establishing mentorship programs and really facilitating information for undergraduates as well. They've been a very active association. And so I encourage you, whether it's Penn or another institution, to really look into, if you define yourself as FGLI, look into what resources are available to support you. And even within your colleges, I know Penn undergrad has a support network and a group for FGLI students. And so really look out for those support. So this was an article also in the AAMC about finding success as a first generation medical student. And, one of the things, again, is bringing the diversity of your experience, for other marginalized groups, for other patients that have a socioeconomic barrier. And you really add to the complexity and also the experiences, and also really enhance your patient's experience. And so one FGLI student just mentioned that the more sunshine we can provide faculty and staff regarding the experiences of people with this life experience, celebrate and accentuate the positive attributes of grit, determination, ingenuity, stick-to-itness inherent in it, I think we can turn around people's vision about what is possible. And so again, I go back to also just encouraging the previous generation, the generation underneath you, that this is really important, that you're successful as well, and that you can teach them the pathway forward. So what are some of the resources? And I don't expect to go through all of these, but just to talk about that there are conferences that you can attend that give information about how to navigate medical school. There's a free website. There's several websites that have the ability to ask questions, to figure out workarounds. And so I would encourage you to utilize these resources. The AAMC has a fee assistance program. There's a first generation college student indicator in the MCAT application. And that's really important for medical schools that are doing particularly holistic review. A lot of medical schools are looking at, trying to look at not just the academics, although the academics are important, but what's the distance traveled? Like how hard was it for this person to get to where they are today? And so having that indicator, I think, is helpful, just so that, medical students understand the grit that it took to get to where you are. There's a great podcast. This is run by, I know a lot about the resources at Penn. So this is run by a medical student but it's a very, very, very good resource, very well done. It's a podcast called MedLegs. And then Prescribe It Forward is a free pre-health mentorship opportunity. And so I would encourage students in general, but in particular FGLI students, to really take advantage of some of these resources that are available. So what are some financial strategies? Like, what are some ways to really get around, some of these barriers? So one is to have your experiences that are going to be great for a med school application to also be paid experiences. You don't have to do everything for free, and you can look out for some of these paid experiences. So you could look for funded research opportunities. There are paid campus leadership opportunities, clinical employment that might help, again, give you that that boost to your resume, while also, making sure that financially that it's helping to float you a bit. Tutoring, which allows, that you could get paid for. There are some summer programs, as I mentioned. I had one. There's some summer programs that you can take advantage of, that in which they pay you a stipend or might be free, that you don't have to pay for. Definitely, as I mentioned, a lot of institutions have resources for this. If you have a credit card, if you can get one, consider getting one with airline credit. This becomes really important as you're thinking about interview expenses. Try to coordinate your interview travel amongst regions so that you don't have to keep flying out to the same spot, but maybe you could get 3 or 4 interviews in. And stay with students if possible. A lot of the medical schools do recognize that this can be quite expensive. And if they have a student sort of hosting program, I did that when I was going when I was looking at colleges. I would, stay with students at the colleges, and you also get an inside view as to like what life is really like when you stay with a student that's attending the school that you're in. So this is something that I learned sort of late in my career, but I was always sort of like, I never wanted to come across as greedy or asking for too much. But what I realized is that some of my colleagues who had gotten much further, or maybe there was an opportunity that I was doing, and they were also doing, but they seemed to be getting maybe more money for that opportunity or something else. So if you don't ask, the answer is no. And it's not, you're going to be professional about it. You always have to be professional about it. But you should ask, and you should ask for things that seem crazy. I remember once going to a seminar, and the speaker was talking about, she sometimes just asks just to practice and just asking, because it can be difficult. It can feel uncomfortable to just ask for something that maybe not even be on the table. But the reality is that if you ask and you push the boundaries a little bit, you will get, surprisingly, maybe you'll get 8 no's, but you'll get 2 yeses, and that's going to make a huge difference when you're looking for something. So this really has to go towards like looking for, financial opportunities, looking for just opportunities in general, that to boost your resume. So just make sure you are moving through life boldly. And I know that is challenging and that can be scary, but move through life boldly and ask questions, and really ask for opportunities. And don't be afraid of that. And it will take practice. I still practice this because I still had this part of me that's like, oh, no, you've been given enough, or that, no, they're never going to say yes to that. And so it's really important to really push the boundaries a bit. So what are the components of the MCAS, right? You have to have extracurricular activities. This is kind of the holistic review. What did you do outside of the classroom? Really, when you're thinking about extracurricular activities, you need to focus on the 3 L's. Longitudinal engagement, meaning that it's something that you spend some time doing. If you did, one shadowing opportunity, that's not going to hold the same weight as, shadowing somebody for a whole semester and developing a really good relationship with that person that they could maybe write you a letter of recommendation. But really having something that also shows that you were committed to this. That also goes not just to shadowing experiences, but that might be a research opportunity, or maybe you are interested in, victims of homelessness or people who are suffering homelessness, and showing that multiple semesters you did that. The other, the other really important thing is legacy. So what's the impact of what you've done? Have you made any changes? Did you have a new startup, organization, student-led organization? Do you have an abstract? Do you have a publication? Did you present at a national meeting? That's really important. And then lastly, leadership is really important, right? Most medical schools are really trying to recruit the next leaders in medicine. You are going to be the next leaders in medicine. And so seeing some leadership within your resume is really helpful to kind of say, well, yeah, this person sort of pushed the envelope. They didn't just volunteer somewhere, but they took on a leadership role. They're experienced in leadership roles because they were able to tackle that. So really keep those 3 L's in mind. Make sure that it's a longitudinal engagement, that there's a legacy that you're leaving, and that you're having some leadership positions. The other thing is strong letters of recommendation. When you ask for letters of recommendation, make sure you're asking early. Give people a month if you can, 2 weeks at minimum. all of the faculty, they're very busy, as you guys have, probably experienced. And so you want to give people ample time so that they give you a good letter, a thoughtful letter. The other thing that students have done with me, which I really love, is they remind me how I know them. We met 2 years ago. I shadowed you in your clinic, and then I came back, a year later and did my clerkship with you, and I presented this patient to you. That may seem challenging, but if you have in mind, your heart set on someone you want to ask for a letter of recommendation, you might want to jot down some notes and say, these were the experiences I had with this person. I promise you the faculty will be super impressed, because most people will send their CV or their personal statement and that's it. But really allowing your writer to have some really specific anecdotes about how they know you will help your letter stand out above the rest. So if you can do that, I think that's really important. I always am impressed with that. Your essays. So when you're writing personal statements, if you need to, take them to the writing center. Have other people read them. Make sure that they really hit the way that you want them to. Make sure that you are really having an experience that's, you want to talk about something that's authentic to your experience. Don't be something you're not. So that's really important as well, is to think about that and write, accordingly to that. The other thing is that's not in here, but just apply early. For medical school, it's rolling admissions, so you want to apply as early as possible. And then grades, we're going to talk a little bit about grades and scores. Do the best you can. Get tutoring. That's my biggest, advice. If you're struggling in a class, don't just accept that you have to struggle. Go get tutoring. If they have peer mentors, or that you can go to, or just a writing center or a tutoring center. Don't be afraid to go to office hours. Just do everything in your power to try to get the best grades that you can, and the best MCAT that you can. And then for interviews, practice. Try not to go in cold. Really practice, answering questions. What's something that, there's very coined questions that most interviewers actually, usually ask. What's something challenging you face? How did you overcome it? Really think about the kind of questions that they may ask you, and have some prepared answers so that you're not nervous. It takes care of some of the jitters of the day. And that, so that's really important. The other thing is doing some research in the school. Make sure that they have the programs that you're interested in. It's really nice to drop, I know it's like name dropping, but to drop, yes, I read about this program at your school and I was very interested because of this reason. And so that really shows to the interviewer that you did your research. And so that's really important. So academic challenges, right? So this is probably, the toughest thing about, amongst some other things about getting into medical school, is really making sure that your academics are, what you need them to be. So just again, as I mentioned, just try to get as much help as you can. Go get tutoring, go to office hours, try to understand where you're not understanding what it is, get help from your pre-health advisor. If you have to withdraw or defer for whatever reason, maybe that's where you need to go, but really rely on the resources that your schools have, because that's just really important. And then I don't know if you guys saw this movie. It was quite disturbing, but this was probably the best illustration that I could think of and this was something that I learned to do in medical school. So pre-health medical school, it's quite competitive. You're with like the best of the best. And, as much as people may or may not try to be competitive, some people just are. And I found that environment sort of made me like go into a little bit of a shell. And I was always thinking like, am I doing enough? Did I study that enough? And I realized that the only person I needed to compete with was myself. And so I know that sounds pretty cliche, but like if I got the A-, like just try to get the A next time. But I focused inward, and that just helped me to sort of reduce the noise that was going on outside of me as far as the competition. And so I just encourage you, this was one of the most helpful things I did, was just be the best me I could be. And this has helped me in, even as an attending in neurology. I just want to be a good doctor. And what does that take to be a good doctor? And so I'm constantly competing with being the best version of myself. This will serve you well. So what's this? It's a SWOT analysis. So businesses do this often, and it's really this is the way I want to encourage you guys to look at yourselves. Like, what are your strengths? What are your weaknesses? What do you need to work on? What are the opportunities that are out there? And what are the threats to your success? And so I think it's a very simple way that we look at program development and how we're going to go from there. And so it's also really good to do as an individual. So if you have time, just kind of do a SWOT analysis on yourself, and then determine how are you going to work on your weaknesses? How are you going to take advantage of those opportunities and the threats that are there? How are you going to sort of circumvent them or work around them if you can? So what about COVID? Right, we're all sort of dealing with this new environment of COVID. This has brought up personal challenges to your support system. Some people are very isolated. It definitely derailed a lot of people's plans, both personally and academically. There are health challenges, some personally, some dealing with family members who might have been sick, but also it shed light to really the healthcare disparities as some populations suffered the effects of COVID much more heavily than other populations. And particularly the African-American community. Here, self-care is extremely important. If you're really struggling, being okay with seeking care with a therapist, connecting with your friends and family virtually, recognizing that this will end at some point. And so focus on things that you can do during this time. And so some ways to sort of still work on your pre-health is to think about research opportunities that don't require in-person contact. Can you do a literature search or write a review paper? Can you get access to an electronic medical record, perform chart reviews? Can you take advantage of the unique challenges that COVID brings to light? Healthcare disparities, innovative approaches to the delivery of healthcare. Can you learn a new skill within this setting? So even though this feels like we're hitting the pause button, there are ways to really still keep yourself competitive or pursue other things that enrich you as a person, and try to focus on that as opposed to some of the what feels like a pause or some of the steps backwards that feel like, that people are taking during this time. So what's imposter syndrome? So a lot of people suffer this. It's the feeling that you don't belong in this space, that you're not good enough, right? And so I will say, even people at the highest level that I've met now, sometimes I ask them, like, you're so accomplished. Do you even suffer from imposter syndrome? And, all of us, or I should say, I shouldn't say all, but most of us have had a feeling of maybe I'm not right. Maybe it's not, maybe I don't belong here. And I think it's just really important for you to remind yourself of why you're doing what you're doing. There are times when it's going to be really tough, but if this is the space you want to be, then you belong here. And you just need to figure out, sort of like what the obstacle is, or what's the support network you need to be able to really endorse that emotion that you definitely can be successful here. So just, imposter syndrome is very real, and just try to avoid it as much as possible and recognize it when you're doing that conversation with yourself of, maybe I made a mistake, maybe I don't belong here. And then, so this really dovetails into preventing burnout and negative self-talk. And so I used to do this, when I was in medical school, and I would constantly say, like, I failed. I know I failed that test. I know I failed that test, just because I think it just felt better to say it, because if it happened, then I could say, well, I told you I was going to do it. And it's just as self-defeating, and it's really important that you don't do that. And so, it's just encouraging really to just try to say positive things to yourself. Of those words that you're telling yourself, they really do impact your psyche. And so it's important that you are saying positive things to yourself, and the people around you are also uplifting you and saying positive things to you as well. And the other thing, this is a leadership program that I did through the American Academy of Neurology, which is the National Organization for Neurology. And I was at the point in my career where I kind of was just cruising, and I was doing really well. And I just, this opportunity came up, and I met the most amazing set of colleagues across the nation, that I now have this network. And it was such an amazing, hard, but great experience as I learned leadership skills and did, things that were out of my comfort zone. And so I would encourage you to look for opportunities that just, push the boundaries a little bit and develop, that allow you to develop yourself as a person. And so just, be comfortable sort of pushing those boundaries. And then these are actually some of my med school classmates, and these are the fields that they went into. And so, one thing that is really important is who is on your team. You need to make sure that the people that you surround yourself are supportive of your goals and your success. And as I mentioned, I had someone in every stage of my life. Maybe it was one person, but that just really took an interest in me. And I had peers that really helped me along and just made me feel like, okay, I'm not the only one. And just recognize that family is defined how you want it. You have your blood relatives, but you can have friends and classmates that become family as well. And sometimes that requires hard decisions about who is really on your team. And you have to ask yourself, who is is this person a team player, or is this person detrimental to the goals that I want to accomplish? And, really just surround yourself with those positive people. So what about mentorship? So for mentorship, it's really important that you pursue a village of people who are on the step ahead of you. So, when AAMC looked at the barriers for minorities to achieving, getting into medical school, one of them was just a lack of knowledge of the pathway that it took to get into medical school. And people said getting deterred along the way because it was so challenging just to figure out how to get there. And so really surrounding yourself by mentors, and more than one. Those mentors should look like you, and some of them should not look like you. So it's really important that your mentor network is also diverse, and maybe even in fields in medicine and maybe even outside of medicine, but they should all meet your needs in some way. And so really start now looking out for people who are going to be invested in you and are going to be helpful for your success. So what's your role as a mentee? And I think this is really important that you come prepared. So a lot of times there's this top-down approach of the mentor is like pouring into you, but there is a way to make a productive mentor-mentee relationship. And a lot of that is that if you request a meeting, come prepared with an agenda. When I was at your stage, I'm not going to lie, that sounded crazy. Like now, yes, when I meet with somebody, I come prepared with an agenda. And maybe you guys do that too, which is wonderful. But really think about having a couple of, like, 1 or 2 points that you want to cover in the meeting with your mentor. It will impress your mentor that you sort of have something, and they don't have to sort of just like, the onus is not on them to really do all of the work as far as the mentor-mentee relationship. Be proactive, communicate, be respectful, be realistic. Your faculty may have some time constraints. How often can you really meet with them? Also, does this mentor have time for you is another really important question. Not that they can't be part of your team, but maybe they can't have such a robust role, and you need to seek out another person that might serve that purpose. And so you constantly have to reassess that relationship. Is it still working for you? Are you still having this good collaborative relationship? And then, last and foremost, what are the competing priorities? And this comes back full circle to the question of who are you and who do you want to be? And so this will help you figure out what club to join. If you should join a sorority or a fraternity, what should you do? There are competing priorities. There are endless possibilities of things you can take advantage of. But if you ask yourself that question, who are you and who do you want to be? It should and hopefully will make the answer to what you should sort of hang your hat on a lot more clear. So I hope that you got, some pearls out of this conversation. Really, your unique story is so important to the field of medicine. Healthcare disparities continue to exist, and one important way to combat this is to diversify the physician workforce. Take the time to evaluate and reevaluate your purpose and direction. And although the pursuit of medicine is challenging, there are strategies to be successful. Figure out what makes you happy and pursue that goal with everything you have. And you do enhance the learning experience of everyone around you. So you do belong in this space, and it's really important that you are able to get into medical school and kind of take the next steps.
All right, thank you so much, Dr. Lewis, for such an inspirational presentation. I know, like, as a first-generation minority student, I got a lot of things out of your presentation, and I love the acronyms, LLL and other one. So it was really good. Now we will transition to the Q&A. So I will ask you the first question from one of our panelists, actually. It's, how do you recommend preparing for a question regarding personal experience in diversity and leadership? should we visualize a scenario we might have experienced?
Yeah, I mean, I think that's a great idea. I mean, I think it does require some reflection and really thinking about things that really shaped you. So this comes into the authenticity piece of, a lot of people say, I had a grandma, and I'm not saying that that's not an authentic experience, but maybe you had a grandma with an illness and that sort of like spearheaded your experience or you're delving into medical school. But there is such a variety, and it's the way that you write about it that can really kind of bring out not like a stereotyped example or personal statement. So I do think visualization is a great tool. I think reflection, quiet reflection, and then obviously, as I mentioned, having that statement sort of read and reread by a variety of people is also a really helpful experience to kind of say, well, what about this? What did you look at it from this angle? That's like, those things are really helpful.
Right, great. Thank you so much. Our next question is from the audience, and I want to remind everyone to please ask your questions if you have any. Okay, let me see. This one, as an African American pre-med student, do you think different med schools are open to letting more underrepresented students into the program? So I guess this, are schools accepting more minority students?
Yes. So, I mean, that's a great question. I do think that, schools are recognizing more and more that they need to promote a diverse student body, right? And so I do think, I can speak, I worked specifically with admissions at Penn, but, just my feel across sort of the nation is that we recognize this is a very important, very important to recruit more underrepresented minorities into medical school for the reasons that I mentioned. I mean, just tackling healthcare disparities. Minority populations are often end up working in underserved areas, and so really we help patients that look like us. So I do think that it's something that medical schools are really focused on, particularly with the recent civil unrest with George Floyd, the killing of George Floyd. I also think it really brought the nation, to its knees as far as like the structural barriers and healthcare within America, as well as what's happening with COVID. So I think even more, and at this state in our nation, you will find that medical schools are dedicated to this endeavor.
Great, I love that. So our next question is from Alice. She says, "Thank you for this amazing information, Dr. Lewis. I'm afraid when speaking of my experience, whether in interview or personal statement, it will come off as a sob story. Do you have any suggestions on how to avoid that?"
Yeah, so I think that if it is, I do agree that some stories are really tough, right? They're tough to tell, they're painful, but it's you bringing your authentic self. So I think that if you write it in a way to talk about the experience, but how it shaped you as an individual, how it really enriched you, or how it might have encouraged you to go into medicine, or just like recognizing your own strength as an individual, if you can turn it into how it really impacted you as opposed to just telling a story, but not really talking about the personal reflection, then I don't think anyone could fault you for that, and I think that will really be something that will be memorable because it's an authentic, experience that you lived.
All right, great. Thank you so much. The other two questions are kind of similar, and they're related to extracurriculars and leadership. So the first one is, what would be some good examples of leadership? Do you need to be a board member of a club, or does being a tutor, for example, count as being a leader?
Yeah, so I mean, I think that that you want to think about leadership within the organization. So tutoring to me, although wonderful, obviously, and does enhance your resume, I think being the head tutor or organizing 12 tutors to go to different schools, that would be more of a leadership role. So I think that just the tutoring or the shadowing does not come across as like a leadership, but it's really within organizations, you being the president, co-president, or even treasurer, whatever it is, and then being able to like describe that experience. Or again, you managing maybe a group of tutors would be more of a leadership, example of a leadership opportunity.
Okay, perfect. And the next question is one that I prepared. And you touched upon this question during your presentation, but I just want to see your opinion. In your opinion, What are some of the initiatives that medical schools and universities should implement to increase diversity in medicine? And if you want, you could also mention some of the programs that Penn has. I know you already mentioned some, but I did want to bring up that the Johnson Scholars, which is a program that I'm a part of, actually helped us with this conference. So I did want to bring that up.
Yeah. So, I mean, I think that one is, I think pipeline programs, as I mentioned, is really important. And Johnson Scholars is a pipeline program. So essentially we support Penn undergrads who are minorities, helping them really make relationships with the medical school, so they can meet key people within the medical school, and then also give opportunities to to research opportunities and other things that happen at the medical school. So I think thinking about pipeline programs, like how are we catching minority students early, and also supporting them along the way. Again, I don't, when I look at minority students, it's not for lack of ability. It's a lot of times it's because, lack of sort of like the knowledge of how to get to that next step, or just how many of you have had the experience of someone telling you, I know I have, of like, you shouldn't go into medicine, this isn't quite right for you, despite the fact that you're doing well, or maybe you're doing on par with your peers, or maybe you're not doing well, but you need to be told to go to the tutoring center, and these are the resources that you should, be utilizing so you can be competitive. So I think pipeline programs are really important. As I mentioned, I think that medical schools need to look at better financial support for minority students. So that's college scholarships, grants, looking at FGLI students and having them, like giving them opportunities for waiving fees if possible. Some of the medical schools are waiving secondary fees, just looking at that specific population. So I think that, and then even earlier on, really like elementary school, middle school, starting to talk about healthcare, I think that early on, I think are just like a few of the steps. I'm sure there are like multiple other steps that we can do, but those I think are really important initial steps. But really that support piece I think is really important, that, we can't just kind of be like, yeah, you should go into medicine, but we need to actually like hold your hand along the way.
Right, great. Thank you so much. I think we have time for maybe another question. So this is another question from Alice. She says, once in a program, how are we as students able to incorporate our diverse experience, and while being respectful to the framework of professors? I guess she mentions like if they ever bring up something that might be a little like sensitive topics for minority students, like how can we stand up and bring up our backgrounds? And
yeah. So this is really tough, right? I mean, this is a really great question, and it's very tough, right? So we are sometimes in spaces in which we are the only ones, right? So it can feel very intimidating. It can feel, it can just feel exhausting, right? To like always have to be like, this is why this is not the same for me, or this is not my lived experience. Like it can really be exhausting, So, but I think, there are certain times where I have felt, within my personal life that like I had to say something, right? But you always should be respectful, because you just never know, and people can't hear you if it's not respectful, right? So for instance, a leadership opportunity came up in my job, and it wasn't a diversity focused leadership position, but I do a lot of diversity work because I think it's important. And one of my faculty, the faculty member that was going to choose it said, we're going to give it to this other person. And it was not based like on any credentials. Like I was more than qualified for the job. And I said in that moment, I was like, even though I really am interested in diversity things, this is not the only thing I'm good at, so like that was my professional way of saying, that's not fair, in a nice way, right? So I do think that there are certain things in which you might have to go above the person, and I know that gets sticky, but there are certain times where people just need to hear it, because some people are really just like, this is their lived reality and they can't see it. And so I think actually hearing it, you hope that even if it's not in that moment, they can reflect back on it later and hear you. So, I know that's like sort of like a general answer, because it's hard to, without talking about the nuances of the specific situation, but feel convicted to say something in a respectful way, and people will take it how they are, but then you're true to yourself, and you can you can feel good that you were true to yourself about it. And hopefully later on that person will realize the next time, or maybe even for you, that that's not right,
Right. Okay, thank you so much. It was wonderful to have you as our guest speaker, and I learned a lot from this presentation, and hopefully all of our participants learned a lot. And yeah, thank you so much again.
Thank you so much. It was really great.
Bye.
Bye.
And now we will have a short break before hearing from our next speaker. So please go walk around, stretch, maybe get some water, and we will be back in a few minutes.